Many people worry when a sore appears inside their mouth. An immediate thought might jump to something serious, like a sexually transmitted infection, or STI. Others might dismiss it as just a simple canker sore, perhaps from biting their cheek. There are many myths about mouth ulcers and their connection to sexual health. Some believe any mouth sore after being intimate must be an STI. Others think it's impossible to get an STI in the mouth. Both ideas are incorrect and can cause fear or delays in care. This guide separates fact from fiction in a calm, clear way. Our goal is reliable, easy to understand information. We will bust common myths and replace them with real facts. We will review different causes of mouth sores and what needs a doctor's attention. We will discuss which STIs can affect the mouth, their symptoms, diagnosis, and treatment. Think of this as a friendly guide that empowers, not alarms. So, what exactly is a mouth ulcer? It is a sore on the delicate tissue inside your mouth, cheeks, tongue, gums, roof of the mouth. They can be painful with eating, drinking, or talking. They look like small round or oval spots, white center, or yellow, or gray, with a red border. Most are aphthous ulcers or canker sores. They are not contagious, not passed by kissing, or sharing utensils, or other close contact. Common triggers include cheek bites, hard brushing, braces irritation, stress, hormones, food sensitivities, and vitamin deficiencies like B12, iron, and folate. Myth: all mouth sores mean an STI. Fact: most are benign canker sores unrelated to sexual activity. They usually heal on their own within 1 to 2 weeks. Knowing this can ease anxiety. Canker sores appear inside the mouth. Cold sores appear on or around the lips. Cold sores are caused by herpes simplex virus, usually HSV1, and are contagious. Location is a simple first clue. Their causes, treatments, and prevention differ significantly. Most mouth ulcers are non-infectious reactions to small irritations or imbalances. Clear information replaces fear. Next, we'll see how STIs can appear in the mouth and what to watch for. Awareness, not alarm, leads to smart decisions. Let's move forward with clarity. While most mouth sores are harmless canker sores, some STIs can show symptoms in the mouth or throat. This can occur after oral sex with someone who has an active STI. Bacteria and viruses can transmit from genitals, anus, or mouth to a partner's mouth and throat. Deep kissing with active sores can also spread infection. Understanding routes of transmission helps you protect yourself. The mouth and throat have soft, permeable mucous membranes, similar to genital and anal tissues. Small cuts or abrasions become entry points for bacteria and viruses. Oral health matters. The mouth is not immune to STIs. STIs that can affect the mouth include oral herpes, syphilis, gonorrhea, and HPV. Some infections may have no symptoms, so routine testing matters. Talk openly with partners and use barriers to reduce risk. Oral herpes is common, typically caused by HSV1, though HSV2 can also cause oral sores. A primary outbreak can include fever, body aches, swollen neck lymph nodes, and multiple painful blisters or ulcers on gums or throat. Afterward, the virus remains and may cause milder recurrent cold sores. It's highly contagious via direct contact with a sore. Syphilis can cause a firm, round, painless sore called a chancre at the infection site, which can appear on the lip, tongue, or inside the mouth after oral sex. Left untreated, it progresses, but early antibiotics are highly effective. Gonorrhea may cause a sore throat, trouble swallowing, redness, or swollen glands, or no symptoms at all. HPV can be asymptomatic. Some strains cause warts, or rarely over years, raise certain throat cancer risks. The HPV vaccine effectively prevents the types that cause most warts and related cancers. If you're concerned, a doctor follows a clear process. They'll discuss symptoms, duration, medical and sexual history, then examine your mouth. It's confidential and judgment-free. They'll inspect the sore and order appropriate tests. Swabs from lesions or throat and blood tests can identify herpes, syphilis, gonorrhea, and more. Once confirmed, treatment is specific to the germ. Herpes, antivirals shorten outbreaks and reduce severity and transmission. Syphilis or gonorrhea, antibiotics are highly effective. Complete the full course. Oral thrush, antifungal lozenges or rinses. HPV has no cure, but visible warts can be removed. The key is seeking care early, faster treatment, better outcomes, and peace of mind. Prevention is better than treatment. Use barrier methods consistently during oral sex. condoms for oral penile, dental dams for oral vaginal and oral anal contact. Barriers reduce fluid exchange and skin-to-skin transmission. The HPV vaccine protects against types, causing most warts and several cancers, including some throat cancers. Recommended for preteens and available to young adults who missed it. Ask your doctor. Have honest conversations about testing and symptoms before intimacy. Avoid sexual contact, including kissing, until a visible sore fully heals and a doctor clears it. Maintain oral hygiene, brush twice daily, floss, and get regular dental checkups. A healthy mouth has fewer microtears that invite germs. Avoid sharing items contacting the mouth, glasses, utensils, lip balm, especially if someone has a visible sore. Be in tune with your body. Most common ulcers heal on their own, but certain signs mean it's time to see a doctor. If a sore doesn't improve after 2 weeks, get it checked. See a doctor for sores with fever, swollen lymph nodes, aches, or feeling unwell. If pain is severe or sores, limit eating or drinking. Seek care sooner. If you suspect a link to a recent sexual encounter, do not wait. Test promptly. Expect professional, confidential care. Be ready to describe symptoms and be honest about sexual history. Trust your instincts. If you're worried or unsure, making an appointment is a responsible step. If diagnosed with an oral STI, communicate with recent partners so they can test and, if needed, be treated. Start calmly and directly. Say you were diagnosed, and doctors advise partners be tested. Share basics about the infection, treatment, and how it spreads. Offer to go with them. Approach with honesty, compassion, and a focus on health. For comfort, rinse with warm salt water several times daily. Avoid spicy, acidic, or very crunchy foods. Choose softer options. Use over-the-counter topical gels for temporary pain relief. Address the emotional side. Seek support from trusted people or professionals. STIs are medical conditions, not moral failings. Caring for mind and body helps healing. In summary, most mouth ulcers are simple, non-contagious canker sores from minor injuries, stress, or nutritional factors, and heal within 1 to 2 weeks. But oral herpes, syphilis, gonorrhea, and HPV can affect the mouth or throat. Many sores look alike. Some infections have no symptoms. Testing is the only way to know. Doctors use swabs and blood tests. Treatments include antivirals and antibiotics. Prevention works, condoms, dental dams, HPV vaccination, and open conversations. See a doctor for sores lasting over 2 weeks, severe pain, fever, or concerns after a new encounter. Be informed, not afraid. With knowledge, testing, and care, you can navigate your oral and sexual health confidently, for yourself and your partners.